Oh, hello. I
Now we can hear you.
okay. Talking to myself. Good morning, good afternoon, good evening, everybody. Thank you very much for joining us on this interesting conversation with people who are working and leading the space in artificial intelligence and really looking at implications in the health sector on human resources and clinical outcomes. So we'll start in about 2 minutes. And so thank you very much for people who were on time. But thank you very much. Okay. Good morning, good afternoon, good evening. Thank you very much for joining us on our first conversation on artificial intelligence and looking at it from a practical perspective in the health sector. There's been a lot of conversation, especially about the sort of new use of generative artificial intelligence. I hope people can hear me. In the use of generative artificial intelligence. And one of the things we're trying to do today is to look at the practical use of AI in healthcare. There's been a lot of conversations around AI, which I'm sure you've all heard or been part of. But what we're trying to focus on today is what is happening today at the end of 2023 in AI in improving health outcomes or making or impacting healthcare workers. And for that, we're going to have two panel discussions with people who both either practical people using AI practically in the business or in the organization, or people who have been observing the AI space. And without much ado, I'm very delighted to present our co-host for this event, which is hosted by Anadach, Covers Health, and also our media partner, the UN. And I'm really delighted to hand over to Dr. Kate Lenko, who I have now known for, actually, Kate, several decades, sort of several decades, and one of the leading experts on healthcare workforce globally, and sort of very recognized sort of globally, and we work together in several countries. Kate, over to you for the first panel. Thank
Well,
you.
thank you so much, Egbert. And for those of you who don't know me, I'm the founder of Corvus Health, which is a global health workforce firm, and the founder of Appleseed Education, which is an ed tech platform to help health professional schools expand and improve. This first panel is going to be on health worker education, just looking very practically. And we're looking at all four types of education: pre-service education, which makes you a health worker; postgraduate education, which helps you specialize; continuing professional development, which is required for relicensure; and then in-service training, which is usually provided by employers to improve quality of care. So we're going to focus on the practicalities. Much of the dialogue about AI so far has been at the very high level about ethics, and that is appropriate, but we also need to dig down at the sectoral level, because in the health sector, there are significant impacts on regulation, staffing, the ethics, the cost, and ultimately who we can provide care to and at what cost. So I'd like to introduce our first two panelists. I'll have the panelists introduce themselves. First is Stefan Wisbauer from Lecturio, and second is David Kamanda from IRCAD. Stefan, please introduce yourself.
Thank you so much, Kate. And I wish I could say I have known you for decades. You know, it's one of these things when you meet someone, you think like, okay, I wish that had happened 2 decades ago. But I'm very pleased we're connected here, and I'm sure you have a very interesting group gathered knowing you. So it's a pleasure to present to you. My name is Stefan Wisbauer, co-CEO of Lecturio, sitting here in Leipzig in Germany. And I'll be sharing more about what we do and obviously the AI topic as well. So I'll hand over to, I think it's David, right?
David, please.
Yes, good morning. My name is David Kamanda. I'm from Rwanda. So I'm the managing director of ICAD Africa. ICAD Africa is a global cancer center for training and research in minimally invasive surgery. Thank you very much.
Thank you so much. So the first question I have for you is, almost no country is self-sufficient in training health workers. And we believe that artificial intelligence can help with this. There are a variety of bottlenecks to training more health workers. It's more expensive than any other type of skilled worker. It takes longer. You need access to patients, which has certain ethical and practical challenges. And then for nursing schools, there's a severe shortage of professors. So how do you see your AI solution addressing this? And how do you see AI in general addressing these bottlenecks? So Stefan, if you could start.
Sure, more than happy to. And Kate, just in terms of timing, how much time do you want me to take? Like 5 minutes or 2 minutes? I have some slides I can show.
The 2 minute,
Oh,
the 2 minute side, yeah.
Okay, so I'll go without slides for now. If you want slides, I have plenty for later if you want. So just big picture thoughts, so we basically build a system for teaching nursing and medicine, and it's very comprehensive in covering the full curriculum, and it's being used in that kind of manner by very large institutions in the US to actually then confer degrees, which we don't, but we enable that kind of process, and so if you think about your question and the different aspects, on the cost side, you can make huge leaps there in both in teaching and assessment, because everything that's sort of a traditional classroom delivery, where, as many of you will know, the modern generation of learners kind of hard to order to attend a traditional classroom lecture anyhow, and even if they come, you wonder what they're doing on their devices while they sit in those comfy chairs, and so so there's a huge opportunity there, especially if you're working in low middle income countries like we also do, like in Ethiopia, and many other African countries, where there is just a lack of faculty as well, right? And junior faculty and everything else, right? So there's a huge leap possible there to shift a lot of that to online learning. And now with the latest AI advances, we've even added tutoring to this equation. So you have a very interesting opportunity if you look back at the research by Blooms in the 80s and 90s around different teaching methods, and how do you get from the typical classroom based results in terms of learning outcomes, and how do you get closer to one-on-one tutoring, which was evidenced to achieve much better results much faster. Tutoring is obviously something that is not really scalable in the traditional format. You'll barely have 100 tutors to look after 100 medical students in a given year. You take sort of a typical US school size, and then in Africa and other countries, you sometimes have, thousands of medical students in one school, like at HMs in Egypt, for example, or many other places. And so on a cost side, with an AI tutor, all of a sudden, which we've linked into our QBank, specifically, you can afford that one-on-one tutoring. Obviously, it won't quite have the same quality. It will be better in some ways because it won't make it will make very few mistakes. It'll be 24/7 available. That's difficult for the traditional tutor. Maybe the traditional tutor will pay better attention to the student's body language and mood and be more motivating. I don't know, but there was an interesting research on AI in medical discussion forums which the conclusion of it was, not so surprisingly, the AI was more accurate than the human contributors. But the part that I found fascinating is that the AI was more empathic than the human contributors, and there goes, another advantage of AI. It doesn't get tired, it doesn't get judgmental if you program it not to, and so on. So there are surprising advantages. So that's on the cost side of things, on the duration, you also mentioned in your question how long it takes, right? Obviously, with AI and personalized approaches, you can potentially do competency-based models where people can go at different paces. They can come in with different backgrounds. You can upskill across the health worker pyramid. Like in the US, a lot of nurses go up that journey, and a lot of that happens online, right? If you look at large institutions like Wally University and others, there's a lot of online instruction going on to confer those higher nursing degrees where the practical training is no longer critical. And I'm not saying it's not relevant, but you can get those higher degrees without needing to do practical training necessarily, depending from where you're coming from and where you're going to, of course. Finally, you mentioned access to patients, and there, if you think about pilots, they go to large training centers in Turkey for many airlines. Lufthansa runs their own. I don't know how cost effective that is, but it's recognized there that it's a super high responsibility job. You can't afford errors, so therefore you do a lot of virtual practice before you do the real practice. And I think that should also be standard in medical education, and it is in many ways. But often with traditional mannequins and things like that, obviously it has to get physical at some point. Nobody wants to be treated by a doctor who's only clicked buttons on his laptop. There's no question there. But nevertheless, where things often go wrong is in the clinical decision making and the mental processes, rather than where I put that needle and not hitting the vein or something like that. And there, the simulation on the computer can add tremendous value at zero risk, and render very intelligent scenarios, render very detailed evaluations that are super helpful for educators. So I'll pause there, but clearly the potential for contribution both on cost, duration, and patient access, I think, is immense.
Great, thank you so much, Stefan. And David, to you, you do surgical training, which we know it can take up to 15 years to train a pediatric cardiac surgeon. And we know that more people die of lack of access to surgery than die from AIDS, malaria, and TB combined. So you have a huge challenge in front of you. So how do you see AI, contributing to educating surgeons and their team?
Thank you, Kate. So ECAT basically offers an exceptional training which welcomes surgeons from all surgical specialties every year. So we can count, we're expecting to receive around 1,000 surgeons every year. So ECAT surgical data science is about improving outcomes of surgery with AI-based software systems driven by clinical data. So we aim to improve the training and capabilities of surgical teams with surgical data science to reduce complications, make surgery easier and safer, and achieve better patient outcomes. So our focus is on 3 areas of AI augmented surgery during training we provide. So we do augmented vision, augmented brain, and augmented hand, just to help the surgeon while doing surgery. So regarding the AI, the nursing and medical training, AI is increasingly integrated into medical and nursing training to enhance education and skills development. So virtual simulation, AI-driven tutorial systems, immersive experience help physicians, nurses to practice clinical scenarios and improve critical thinking and decision-making skills. This is very key and facilitates a more tailored and cost-efficient learning experience for nursing students. And finally, we also contribute to the kind of ongoing professional development by offering virtual patient cases, augmented training programs, and staying abreast of the latest medical advancement and protocols. Thank you.
Great, thank you so much. And the second question I have for you is, looking into the future, what do you see as the regulatory changes that are going to have around education with AI, or the ethical or technical challenges, and how will we address these?
I think so looking into the future regarding regulatory challenges, this may involve establishing clear guidelines for AI in health workers' education to ensure that privacy and data security is there. So ethically, we have issues may arise regarding fairness, transparency, and accountability in AI algorithms. So as a solution, so there's continuous research and development along interdisciplinary collaborators where we will be, so we need essential to address those technical complexity and ensure that AI systems align with dynamic nature of healthcare and education.
Thank you.
So yeah, my thoughts on that, obviously, those are big questions, Kate, right? But just some specific comments. So on the one hand, obviously, one of the things that's coming up with AI is the cheating gets easier as well, right? So you can create content more easily, but you can also install a little plugin into Google Chrome that'll answer that quiz question for you on that test. So so on the one hand, that means a shift in assessments, I think, is necessary of sorts. If you really want to qualify a doctor, obviously you need to either have a very secure online exam setup, and obviously that's possible in exam centers and so on and so forth. But also, institutions are moving to more live assessment, more dialogue, and I think that actually offers opportunities in healthcare. There's a lot of sort of bachelor theses that are written by professional agencies or, at home. And these days, most people would be tempted to use AI for that kind of task, and kind of logically so. And first there are some initial universities that are abandoning this. We'll no longer write bachelor thesis. We'll do other assessments instead, and they actually see an upside in that. So that's on the cheating side. Obviously, on the cheating side, you can also pitch AI against AI, right? So, like, for example, we integrated an AI proctoring tool in our solution, so that then not only is my browser locked down, but I'm being recorded, and if I keep on looking at a certain place, the algorithm will pick up suspicious eye movements, and my suspicion score will go up, and then you as an educator can review and actually watch that video and what might I be doing there, and so on, right? On the technical side, I think that's a fascinating part. If you think about the impact potential for Africa, historically it was like, okay, now we can do processing and video editing and all these things, and need a bigger computer to do that. But with these generative AI capabilities, I mean, you can do it on your smartphone, right? And all the computing power happens remotely, and then you get the result back, and the result is, is very impressive what it does on the text front, but now it's starting to create images, starting to create videos, starting to create voices. So there's just tremendous potential there. And luckily, the device aspect is unlikely to prove a huge obstacle. If you can equip a medical student in Africa with, even like a $50 phone that does this sufficiently well, and if you spend 100, you get a good one. That's the kind of thing I buy for my kids here in Germany, and it's kind of perfectly sufficient, So that's on the technical side. On the ethical side, it's interesting. Obviously, it's not that we don't lack ethical challenges in the healthcare system, right? If you think about access to drugs for COVID in Africa, or you think about more broadly in education, access to education, whether it's health education for the population or for nurses, doctors to have good educational opportunities, have them be affordable, and so on, is far from obvious. And there are, obviously, first regulations coming. The EU just passed a substantial one. I haven't read it, but, a lot of people wrecking their brains, a lot of people warning. Frankly, my biggest concern is more like the abuse by dictators and criminals and so on of AI, and the kinds of damage you can unleash by engineering, chemical or biological, other weapons, things like that. Hacking systems. We're all so dependent these days on systems that provide everything that we need, whether it's water, electricity, transport, everything else. And so obviously with enhanced AI capabilities in the wrong hands, you could also imagine a lot of disruption, So, but obviously we need to take these ethical aspects very seriously and put a lot of brain power onto it. The big challenge is going to be the speed, like these things evolve so fast, and how can we keep up, the EU was fairly fast here now as well, and I think that'll have to be the case. The regulators have to recognize that they need to be much faster than they've traditionally been.
Yes, actually, I think that last point is particularly important. Regulators sometimes only update every 5 years, every 10 years. I do think that with AI on both the education side and the clinical side, they might need to look at that on an annual basis. I think you also made a very important point on the ethics side, that there's the ethics of, trying to prevent people from making mischief, addressing the bad actors. And then there's the ethics of people who are trying to do good. What is good and what is damaging, both in the education side and on the clinical side, because people well-meaning can do things that are harmful. I see in the comments someone has mentioned that AI generating misinformation can be a big problem. I mean, we have seen that ChatGPT will make things up. And I think that brings to the point that both for health worker education and practice, the tools they use have to be health specific. That they, and they have to have the controls to make sure that if they don't have the answer to something, they say that, and that they don't make things up. That's a very important point. So the final question that I have for you, and then we'll move to the other panel, is COVID overnight really eliminated barriers to online education. Many regulators, right now, before COVID, almost 100% of education had to be done face-to-face, and now they're moving towards more being done online in many different modalities. So how do you see your AI platform in specific, or AI in general, helping with this and helping give education to people in rural areas, or helping practicing physicians and nurses update their skills? So sort of on the online aspect of artificial intelligence.
Yeah, and I'll do it like David, follow on this and then pass back to him if that's okay. Obviously COVID, big disruption, and people had to learn fast, and it was surprisingly effective in a way, but obviously it had its limitations. We call a lot of it sort of emergency remote teaching. If you do remote teaching, blended learning by design, you can obviously do a lot better than just sort of transferring everything onto Zoom, right? And so from our perspective, the AI tutor is an important thing. We're going to continue to evolve. Another aspect that is getting a lot of interest is, I mentioned the faculty shortage, and the faculty are busy often, and they have to write a lot of assessment questions. So we've created an AI assessment question writer. So if any of you on this call are interested in assessments, feel free to reach out to me. And it's proving very popular because question writing is proving difficult. It's got a lot of rules. AI is surprisingly good at it. Obviously, they need to edit it. Our senior editors are saying like about 50% of the question output they still need to tweak a little bit, but 50% is kind of pretty much perfect out of the box. And in general, of course, I think the bigger shift there allows for different degree of personalization. As I mentioned in my first answer, you can potentially advance at different pace. Doesn't have to be all in lockstep, as most systems are still typically operating. And we're seeing, like you were mentioning, the target groups. We're deploying this from high-end US schools, some of the largest, to literally be the engine of their programs, but all the way to deploying the same technology for community health workers in Ethiopia. We've just been touring the country and training people, and they sit in computer labs and see it on screens. They don't all have devices, actually, right? But still, obviously, through the devices that they have not personal ownership of, but access to, again, you can already transform and contribute a lot, and it's quite impressive if you compare Germany with Ethiopia. When I had COVID here in Germany, nobody brought me any devices to track myself or the like, and some Kenyan health workers have done that, and in Ethiopia the nurse who comes to visit you comes with an electronic community health information system, and so we're sometimes more paper-based here. And that's my final comment in terms of this opportunity, where you're not saddled with massive legacy systems. You can actually be early adopters and do some amazing things with this.
David, if you'd like to answer that question.
No, thank you. I think with COVID, the world has